Welcome to Justice Talks. This is the podcast where we use trauma responsive practices to inform criminal justice reform. My name is Dr. Lori Hall, and today I'm joined by two guests. If y'all want to introduce yourselves.
Yeah, I'm Cladis Bilali. I'm a PhD student in the Department of Criminology here at USF. I'm also a psychotherapist, so I work with people who have experienced interpersonal violence. Now, more recently, I've worked with patients that are diagnosed with HIV that have experienced a lot of issues related to abuse, exploitation, interpersonal violence. So I try to take a trauma-informed approach to a lot of the work that I do clinically, and that in turn informs a lot of the research that I do.
My name is Evelyn Harris, and I'm a criminology student. How do I follow that
I
up?
feel the same way. Like, how do you follow that? Like,
I do an internship.
I'm just here. We'll let her talk.
No, I want to hear everything you have to say. That's so cool.
It's amazing.
Thank you. I appreciate that.
Yeah. So thank y'all for joining me today. So today we're talking about what is trauma. And it's definitely a word that's really, really difficult to define.
Mm-hmm.
I think a lot of people struggle to define what trauma is. And we also throw the word around everywhere. Like whenever it's like a difficult, that was traumatic, right? But for me, based on the work that I've done, the research that I've conducted, trauma really involves three things for me. One is that it overwhelms our ability to cope. One. Two, that we're alone or disconnected in those moments. And then lastly, we're not able to successfully integrate those experiences into our overall experience or our long-term memory. And so generally it begins with that experience that overwhelms our ability to cope. And then it's paired with, one or both of the other two, that disconnection. And just from pulling from the work of Bessel van der Kolk with The Body Keeps the Score, I really find a lot of value in understanding trauma in the disconnection that occurs. What are your thoughts about trauma? Like, how would you go about defining that?
Exactly what you just said. I think often when I talk to my patients about trauma, I try to make the distinction that it's quite different from stress, right? Because a lot of people think, oh, I'm so stressed. I'm in grad school, we're trauma bonding with our cohort mates. And it's, and of course, it's thrown around a lot, but it's quite distinct from stress. There's this really great psychologist, George Bonanno, and he does a lot of research on resiliency and specifically resiliency following traumatic experiences, right? And one of the things that he says is that, on a day-to-day basis, we experience so-called traumatic things, distressing things, stressful things, but our body and our brains naturally can deal with those things. So some examples he uses in his research is getting married, getting divorced, having kids, right? Things that are just naturally part of life, right? We go through these things through many developmental stages, and we learn to adjust and we learn to deal with it. And it's one of the many reasons why, as therapists, we actually can't diagnose PTSD until about a month after a traumatic event has happened, right? So with that, there's this understanding that we're going to have this natural reaction, right? We're going to have some temporary dysfunction following a traumatic event. And so we allow that month period to see, okay, how will the patient react after these 30 days, 31 days? But the distinction between stress and trauma is very important to make, for sure.
And I like that you pointed out that diagnosis of something like PTSD is delayed because what really is going on is like acute stress. Right. And so generally, if it continues and it persists and they're not able, in my definition, right, to successfully integrate that, that's when trauma kind of develops. Right. And another part or something that Bessel van der Kolk says is that trauma isn't necessarily something that happens to us, but rather what happens within.
Yes.
And for me, I think that is huge, but it also is the explanation for the variations in experiences that lead to trauma for some people and don't for other people, right? Because it's quite literally something that's going on within us. It's overwhelmed us as an individual, right? We have some kind of disconnection. We feel alone, right? Whether it's an actual physical alone or an emotional, psychological alone, right? And then we're not able to successfully kind of work through that and process that. And I think that that self-reflective part of that is so crucial to the determination of whether or not this is going to be long term or if you're going to be able to manage this at some point. From the work that and the reading and things that you've done, Evelyn, like when you think about trauma, what do you think about? Like, how would you define that? Would you add anything?
I don't know. I feel like you guys pretty much covered the bases. I was go along the same lines of saying that it's not like it's very, I feel, an overused word in the sense of like this was traumatic, like, you know, stuff like that. But I don't know. I feel like you guys pretty much covered it, because I would just say again that it's something that happens internally. It's not necessarily like you can obviously have like bodily trauma, but like I feel like there's a bigger psychologically mental part to it.
And I think you bring up a good point too. A lot of times when people talk about trauma, they're using it mostly like we recognize trauma that's like a physical, and we give validity to that, right? The actual like things that we can see, right? Somebody gets into a car accident and they're physically injured, or you know, somebody is attacked, like we can, oh yeah, that's you know, you've experienced trauma, right? And even in the medical field, right, trauma is like almost exclusively like these really significant injuries, right? But the invisible things we don't necessarily give validity to, right? We, you know, a lot of times there's a lot of stigma attached to those experiences. And we also do things like we shame people, like, you know, you need to get it together. Like, you need to figure out how to fix that. That's a you problem. Right. Like, I don't know what's going on, but like, work it out, you know, and like, we can't, it's hard for us because we want to quantify so much, and like the tangible, the physical things we can quantify. Oh, like that's valid. That's real, right? That happened. But when you say that, you know, some experience that didn't result in physical harm, right, is quote unquote traumatic, right? We're like, girl, you need to get it together. I don't know.
We're very judgmental. It's
and rough.
I completed about a 2-year internship at a human trafficking safe house when I was living in Orlando, completing my master's. And one of the things I had to do was I worked with trafficked girls who were involved in the justice system, the child welfare system. And one of the things we did was facilitate family reunification sessions. And now these were girls in a residential setting. Their parents were miles away from them. All the sessions were conducted virtually, but I was in person there with the client. And one of the things that became very apparent to me as a clinician was the parents can come to understand that their child has endured something really traumatic, right? They know about the physical abuse, they know about the sexual abuse, but they really did not understand the psychological impact that those traumatic experiences had on their kids. And a good example of this is when I was working with a parent who, there was just so much familial dysfunction between this particular father and this young girl that I was working with. And so much so that we started out therapy by just starting out with the father individually and then with the young client. And the father seemed very angry at the fact that his daughter had not made enough progress in our program. He had noted that she would frequently run away. She was aggressive. She was disrespectful. He was scared that she was a bad influence on other kids in the house. And to a certain extent, I can understand that perspective, right? It was very hard for him to come to understand how this, call it what you want, right? Like these externalizing behaviors, delinquency, what have you. He didn't quite understand that a lot of these things were responses to that trauma. I have had kids that have grown increasingly agitated at the fact that I've worn a white shirt to work because it reminded them of the doctors when they were Baker acted. So it's things like that really, really trigger somebody. And it takes so much time really as a clinician to build that rapport, build that trust, to get them to a point where you can gently challenge them and say, a lot of your behaviors, can you see how that might impact dad or your relationship to your dad. Let's talk about that. And interestingly enough, when we were talking earlier about how trauma can be subjective, I totally see that with my clients, right? Because I speak with my patients and I have their chart, right? I'm like, okay, sexual abuse, definitely need to touch on that, physical abuse. And you get to talking to them and they're like, I don't want to talk about that. I want to talk about my relationship with my mom, you know? So it's kind of interesting because what is salient for them, right, perhaps may not be, like, from the perspective of the clinician, the most pressing thing for the clinician. So it's just so interesting how trauma manifests and how different people within the family unit can, including, you know, the clinician, kind of perceive that and navigate those complicated issues.
Yeah, and I think that I think one of our greatest hurdles as, you know, like a species, as humans, right, is that we really have not done enough to learn about human existence,
Right,
in terms of the psychological, the mental part of that, but also the connection that it has to the physiological and the behavioral. You know, I was thinking, like, when you're giving examples of like the behavioral manifestations of trauma, right? And I'm thinking, like, we don't acknowledge those things, right? We don't ever say, I mean, I think to an extent in like the mental health world, they do, right? But like in the rest of the world, right? When people act in such a way, right? Whatever it may be, we do not ever like equate it with a connection to anything.
Right.
Right. And so like if someone is to become belligerent about, you know, some minor thing in our view, we don't go, oh, wow, they've probably experienced something really traumatic. Right. We're like, look at that guy. What's wrong with him? Right. He needs some anger management.
Yeah.
Right. Or, you know, like when a young girl runs away from home, right? She's a delinquent.
Yeah.
They don't, outside from the mental health world, right? They don't go, she's being abused.
Right.
Or there is someone harming her.
Right.
They don't. And they think that she's the problem, right? These manifestations of, and even things like you bring up, like triggers, right? We're still not at a place where we even are like, yeah, that's a thing.
Yeah, right.
We're like, oh, you want a trigger warning? Like, okay.
Right.
Whatever. You know, like, but, and for me on an individual level, like, I have complex PTSD. I went through some very, very traumatic things as a very young, I was born into, right? A very traumatic experience. My father and my mother had a very, dysfunctional, toxic, abusive relationship. I was born into that. And I have experienced a host of things as a child, but also as an adult. And so for me, it took me most of my life to even learn that I was being triggered. And it took me even longer to learn what that was connected to. Right. So like I, would get anxiety, or I would get depressed, or I would be dealing with self-image issues, or I would, doing things that I'm not necessarily ready to speak about. Right.
Yeah.
All of these things. And I internalized those things as I'm broken and I'm bad. Right. And that is traumatic in and of itself, because there was that disconnection. I was alone in reflecting back, like I was alone in all of those situations, at times physically alone. But all of them, I was psychologically, mentally alone. Right. And I wasn't able to successfully integrate those into my experience and to understand what was happening. And, like that this was external to me, right? It was always, I am bad and something is wrong with me and I'm broken. And then as I aged and, things happen, whatever, it was always, there is something wrong with me. Right. And it took me a very long time to the point where now, like I can recognize some triggers. I am still not successful at all of them. There are times where I at least am able to say I was triggered.
Yeah.
That's as far as I can get, you know? I can't even go as far as to say I was triggered by this because of this.
Yeah.
Right. And I think that conversation is so important just for ourselves. Right. So once we know that we've experienced something that has become traumatic for us, meaning, you know, like it overwhelmed our ability to cope. We were alone in that and we have not been able to successfully integrate that. It has become traumatic for us. You know, once we're able to identify that, then we're able to start saying, okay, well, I am feeling this way. And alexithymia is something that like I struggle with, you know, I'm not able to identify emotions and what I'm feeling and put words to that, right? Like I can say I was triggered. I could not tell you sometimes like how I feel or what I feel, right? And so we don't know, right? As a human species, like we are still like in the infancy of even understanding that, but also finding ways to educate our public, right, about this, because like we don't even, you know, my father's generation, if you start talking about trigger, he's like, what weapon do you got? What kind of gun do you got? And I'm like, no. Like I'm talking about things that happen that trigger the physiology within my body that say alert, right? That's what we're talking about with triggers is alert. This is our alert system saying there is danger, right? And it sucks.
No, absolutely. And the cognitive distortions is what we call it, those scripts that we have for ourselves. So a lot of the patients that I work with come in and they recognize that therapy, you know, is going to involve talking about some really difficult things, right? Understandably so. So again, that trust building, that rapport building is so, so important. And it's really not like a single session type of thing. It's a phase, right. It's a stage that we constantly have to do throughout the course of therapy. But the cognitive distortions are very powerful. A lot of the patients that I work with, a lot of the kids, adults, you know, they've carried this idea of who they are for a long time, right? So, you know, I've worked with kids that have what we call catastrophization, right? Nothing will ever be okay again. You know, it's no one's ever going to love me again. I really should not trust anybody else because of this thing that happened with my mom or my dad or, you know, my romantic partner. And they can be very, very powerful. I mean, they really do dictate the relationships that we have with ourselves, but also with other people. So working through just identifying how they're looking at the world, how they're perceiving themselves, how they're perceiving the violence that they've experienced, that is such an important part of the mental health counseling process. But it is a lot of work. And I kind of right off the bat, I'm very blunt with my patients and saying that, you know, at some point we will be talking about some very difficult things, you know, and you're more than welcome to share as much as you want with me about your experiences. The more you give me, the more of an understanding I have of the lived experiences that you've, experienced. So it's definitely, you know, healing is not linear. I tell my clients all the time, expect relapse. And I don't mean just relapse in the sense of like going back to like alcohol use or drug use, although we do see that. But in the sense of, you know, expect that you will have thoughts and feelings about returning to a former partner that was toxic. You know, will have to kind of reestablish some boundaries, reinforce some boundaries. You know, what will that look like? And the earlier on you have those conversations, the earlier on you can start incorporating a plan of action into safety planning and treatment planning with your patients. But yes, the journey is very long, a lot of ups and downs, and it's not linear. That's the most important thing, is it's not linear.
Yeah, and I love that you said that because I tell people that all the time, like healing is not linear and there's not even a destination.
Yeah.
You know, like imagine that. Like we're going on a trip, but we're gonna take a couple of twists and turns here and there. And by the way, like we don't even know when we're there, you know. And I think that it's difficult, but also you mentioned like this idea of relapse, and I'm not necessarily meaning like relapse with drugs or alcohol, but just, you know, going back to, right, returning to. And I think that that's hard for people who have experienced trauma, that there are going to be moments where you were doing better than others, right? And it's difficult to get back on track,
Mm-hmm.
but it's so important, right? And you also mentioned something I was going to ask you. You said, like returning to a partner or a relationship or a
Mm-hmm.
parent or whatever. I want to ask your thoughts on something. I was thinking about this before. W- do you think that this returning to,
Mm-hmm.
right, like a previous relationship or whatever, I guess they're all relationships, scenarios. Do you think that that same kind of idea can occur with places?
Mm-hmm. Absolutely. It's kind of interesting because at the safe house that I worked for, I mean, it was just like a bunch of different girls that didn't know each other, had to learn to live with one another. And there were certain neighborhoods that did not surround the specific safe house, but were close enough to where they kind of established where they would want to run away to, right? And it's kind of interesting because when they had this house, the house mother drive them around, there were certain spots, gas stations, certain places where these girls had been exploited, picked up by random people on the street, buyers of sex, traffickers. And over time, those places began to be triggers for our girls. So we kind of had to figure out, okay, if somebody is planning to run away, like how do I work into my treatment plan? Like run away here, but not here, right? Like you can't, that becomes a very tricky conversation because you don't want to encourage running or eloping, but you want to make it known that you're going to fall off the wagon occasionally, okay? And it's not a if, it's a when. And if so, what are the steps that we can take to work on together to make sure that you get back on track? It's very, very difficult to change behaviors that were kind of set in. I had a clinical supervisor kind of describe it to me this way once. If you've ever grown up on a farm, there's cows on a farm. And when farmers let their cows go on and graze, right, they take a similar path to get to where they need to go. And eventually they beat down that path. And our brains work in a very similar way, especially when we have this history of trauma. Like we're so used to doing things a certain way, right? Going back to the certain people, because in a very strange way, especially when we talk about trauma bonding, for example, there is a sense of comfort knowing that, these people, these places, these experiences that you've had in the past, because you're so attached to them, there's a very weird sense of comfort to them, right? Like a lot of the patients that I work with talk about, I really miss the fact that me and my, former toxic partner would do this and this together, and how he would be there for me when my parents, did this or that. And so that's kind of how those conversations start, and they start to kind of think about, okay, like, does this mean I'm veering off track? Like, am I veering off that track, or do I need to get back? Or and you explore those with your clients, right? Because again, at the end of the day, it's very hard for them to come to understand why they're behaving the way that they're behaving. In which case, it's really, really important to reintroduce a lot of that psychoeducation about trauma bonding, and also make a plan of action. Okay, what do we do when you're having these feelings? Because as a therapist, I'm not there all the time to hold their hand and say, if you're having feelings, don't give him a call, right? You should be blocking him. How do they cope when I'm not there? How do they cope when, there's other people within their social circle that are not there? But to your point, it's really, really important to have that social support and familial support. And unfortunately, what we find is that with so many people who have a history of trauma and abuse and violence, the ones that don't have that social support, that social system, are the most vulnerable. And unfortunately, those are a lot of the patients that I work with now at the HIV clinic. So
I want to work this out a little bit more because I think that this is a place that people really, really struggle with understanding from an outsider view, right? So on a personal level, when I was young, I remember experiences that I would have that were not necessarily good for me, right? But I always found myself, I would go back to the same situation, right? And as I got older, I was able to kind of combat that more and more and get through that. But even present day, and this is a weird feeling that I have frequently, right? And most of the time, this is in low moments.
Yeah.
Right? These moments where maybe I'm struggling with self-concept, or maybe I'm struggling with self-organization. combating some cognitive distortions, right? But I feel drawn, and that's a weird word.
Yeah.
But I feel drawn to go back to this particular place, right?
Yeah.
And for me, it occurs in two ways. One, it's either like the town that I was born and raised in, which is where everything bad occurred, right? Or two, it's like to be surrounded by my family, and I use that term very, very loosely, because these people, were very harmful to me, right? And there's no sense of like love and adoration in those relationships. There's no sense of support, but I experienced that draw, right? Quite literally, like I'm gonna run away and go back to these places, right? And of course, like I'm getting better, right? On a personal level about like, like, okay, well, that's, stupid, whatever, like you shouldn't. But I've fought that. And we're talking for a very, very long time, but even to this day, where I am, right? And so to think about, I have so much distance, right? Between the, now and then. Then is when these things occurred. But there's also a great deal of physical distance, right? But it's still there, right? And if we're talking about individuals that there's not a lot of physical distance and there's not a lot of time distance, like that pull is even greater. But what are we talking about? That pull, what is that? Like, is there a term for that?
I don't know. I think the way that my patients have described their experiences, right? Like I work with patients diagnosed with HIV. A lot of them either homeless or have no choice but to live with toxic family members, right? And so a lot of the time, or toxic partners, and a lot of the times they have such a hard time establishing boundaries in those contexts, right? Like one of the things I always talk about with my patients is, even in those situations, you can still try to gain some control back, because a lot of your control, a lot of things are out of your control. But think about your boundaries. Like, how tall do you want to build your boundaries, right? There's some people that have no boundaries, and, people kind of come and go as they please. There's some people that have super, super strong boundaries, right? Super stringent boundaries, to the point where they're not letting anybody in, not even people who haven't done anything to them, haven't hurt them. And there's people that are somewhere in the middle, right? But that is very interesting. I'm almost wondering, kind of going back to your need to want to return to these people, your family, town. What do you usually visualize when you go back? Like, are you wanting to change something? Are you wanting?
No, it is to experience a feeling. And it's a very specific feeling. And it's a feeling of alive, which I think is the weirdest thing of all, right? Because, and that is a weird thing, I think. Like, I am wanting to return to feel alive, right? And so then I'm thinking, like, this is a problem. Like, there is something wrong with this. Like,
I'm almost wondering too, because a lot of times my patients will tell me that we'll kind of normalize abusive relationships by saying, yes, it's kind of toxic, but I like having that passion, that spark. And one of the things I like to do with them is try to explain that when you're in these relationships, it's fight or flight mode. Like, you're in adrenaline mode. You have so much cortisol pumping through your system, and your body really tries to get used to that, right? That becomes your new normal. That becomes your new baseline. And so when you get out of that relationship and maybe you get into new relationships with, people that aren't abusive, sometimes what I find among my clients is that they find those relationships boring. They're like, I don't know, he's not really doing it for me. There's no passion there. I don't know. That violence and abuse has become so normalized where it has deeply and neurologically impacted people. So I'm wondering almost if that wanting to feel alive is related to that adrenaline rush.
Oh, I think 100%, because when you said it, I started to think back. Like, I had to go back home a couple of years back when my
Mhm.
father passed away. And I remember the entire time I was there,
Mhm.
like one, I didn't go anywhere except for where I was needing to be
Interesting.
for the funeral.
Mhm.
But like, I was like constantly on edge and I was
Wow.
like, you know, like everywhere. And then after I left, I was like, I'm never going back there again. Like, I can't handle that. Like, that was way too much. But the thing that perplexes me
Mhm.
is that we're talking, you know, decades.
Yeah.
And it's something that I am still struggling with. And I can
Mhm.
only imagine, right,
Mhm.
that individuals who've experienced these very traumatic things that has resulted in trauma for them.
Mhm.
When we're talking about this, we're not talking about it with the understanding of the invisible,
Right.
right? The things that they're constantly struggling with,
Mhm.
constantly dealing with, the triggers
Right.
and the distortions and the issues with their self-concept and their image.
Mhm.
And not to mention, if you add on top of that, if they have a substance use disorder or any other confounding mental health challenge, right?
Mhm.
We're not talking, you know, like we have to include those things, but we're not even recognizing it's like, oh, you know, like you were in a car accident. Okay, well, we need to provide you with all this treatment. Oh, well, you know, were abused as a child. Well,
Mhm.
now you're not.
Right. It's
So-
almost like, oh, like what reason do you have to still be traumatized because you're no longer in that? The traumatic thing is no longer happening, and they're kind of forgetting like that second part of trauma, right? Which is, despite the fact that you're no longer exposed to that distressing thing, it has had a lasting impact on you.
Mm,
And that's what makes it PTSD. That's what makes it traumatic, right? It's not, right? Like if I were to point a gun at you, I would expect you to be like, oh my gosh, like this person is crazy, right? Like you're not going to
Yeah.
think straight. That's such a normal reaction. But let's say, you know, I was arrested, whatever, you seek safety. If you're still thinking about the event, right? And then it's been couple weeks and then a month and then 2 months, I'm like, at that point that becomes trauma, right? The fact
Yeah.
that you're not over it, that you haven't explored it, that you haven't processed it, is traumatization.
yeah.
And it is very complicated for people who have never experienced that, or who people who don't work with people who have experienced that. It's very difficult to understand because people who have been through it themselves struggle to understand why they're reacting
Absolutely.
so irrationally, right?
Yeah.
But it's hard. It's a very long road to you know, progress. And I always, when I work with my clients, I always tell them, you know, we always have to redefine what progress means.
Yeah.
I remember working with the kids at the safe house, and they would run away all the time. There was one time where I had to chase a kid down the street. I was like, I bought these really cute boots for work and I couldn't even wear them. I had to stick to sneakers just in case they ran, which was, you know, part of the job. But it's, one thing I said to them, you know, let's look at your progress this past month. You only ran away twice rather than 5 times. And for them, that's honestly very good, because considering what they've been through and the severity of their issues that they've had in the past. So redefining progress, I think, redefining what it means to have made progress in your journey is super important.
Yeah. And you pointed out something that I think is extremely important. One, you said the second part of trauma, right? And I love that, because we often only focus on the event and not what it leaves behind. You were talking about this idea that even individuals who have experienced it struggle to define it, right? And I think that that's so important to talk about too, because if we look at the data on trauma, right? I think it's, you know, somewhere around 80% of people over 21 have experienced at least one, right? When we talk about justice involved individuals, the number shoots to, I think, 97% of individuals who are involved in the justice system or impacted by the justice system have experienced at least one, right? And then the number, you know, for 4 or more is extremely high. So basically what it boils down to is the vast majority of adults have experienced some type of event that has led to trauma, right? We also do not understand it enough on an individual level to even recognize that what event, whatever it was, experience, event we went through, has resulted in trauma for us as an individual. And if we don't even know, right? How, like some people outside of us might be able to say, hey, something's going on.
Right.
But until we know,
Mm-hmm.
like we can't even begin to address it.
Mm-hmm.
And I think that it's extremely important for us to have more conversations about what trauma is, what it looks like,
Mm-hmm.
and how it impacts people, but also understanding the distinction between stress,
Yes.
right? We all experience stress.
Mm-hmm.
Trauma is a very specific process,
Mhm.
right? So, like we said, trauma is anything that overwhelms our ability to cope. It leaves us in like aloneness or disconnection,
Mm-hmm.
and we're not able to necessarily integrate that, right?
Mhm.
And so it leaves a residual,
Right.
right? So thank y'all for joining me today. This is Justice Talks. This is the podcast where we use trauma responsive practices to inform criminal justice reform.